At one time, the femtosecond laser took the world of refractive laser surgery by storm. But is it really time to crown it champion for flap creation in LASIK? Since 2007, the LASIK procedure volume in the US has fallen by approximately 50%, and the only real difference is the impact of the femto laser. We're here today with Dr. Jonathan Wolfson, founder and medical director of the Wolfson Eye Institute. Dr. Wolfson has performed over 90,000 LASIK surgeries across decades of experience and is here today to share with us how he is dedicated to improving the vision quality for many people every year. Well, Dr. Wolfson, welcome to the program and thanks for joining us today.
Well, Matt, nice to see you. Glad to be here.
Our topic today is a hot one, Dr. Wolfson, femto versus ML7 for cutting the corneal flap. Now, I know that you're a big fan of MedLogic's ML7, but have you always used a microkeratome or have you dabbled a bit in femtosecond laser?
I was one of the very early strong adopters of LASIK in general in the US. And when femto flaps came around 2004, we did look at that and we bought a femto laser at the time. We still have a femto laser and we still do some patients with a femto laser. Surgeons made that move to femto flaps for two main reasons. They were trying to make very thin flaps and they had real issues around safety, making sure that the flaps were consistent and safe and didn't have any of the really bad problems that keratomes had in the early days. And so I've gone through many different generations of keratomes. And I really do think that the ML7 that we're using is the best one. It's worked really, really well for us because we're able to make flaps that are really thin, very smooth, and consistently safe.
Now, I cruised your website a little bit and I saw this really interesting video where you talk about how data-driven you guys are over there with the Wolfson Advantage in outcome analysis. What do you think are the main factors that you see in those outcomes that have led you to using the ML7 over, femtosecond laser?
We still do some femto flaps, but we do more patients with the keratome. What we did do is we looked at the numbers and said, okay, what's our safety record like? What do the flaps look like? What do the thicknesses look like? It was consistently very smooth, consistently right around 100 microns, which is what we were shooting for, with a very low standard deviation.
Well, right on. I mean, you've had both now, but you are an ML7 user. So why do you use the ML7 more, would you say?
We get good results with both. I fully understand that most surgeons, especially in the US, are using femtos, and that works great for them. That's fine. And for select patients, we use keratomes, and the patients just seem to have a much better experience because it's just an easy experience for them. And it's very common. I let patients bring a significant other into the laser room and hold their hand during surgery. It is very common for patients or their significant others at the end of the surgery to say, is that it? Are we done? That's it?
Yeah.
Because it's over that fast.
Let's talk efficiency. Patients want to be in and out of the clinic only once. And for surgeons, satisfied patients and more procedures in a day is the goal. So how does the ML7 help with this, would you say?
We focus on the patient experience, and I think we're really happy with the fact there seems to be less pressure sensation on the eye for the patients. From the time we start one eye to finish that eye in completion is just a few minutes. And that's why for us that works really, really well.
What about the ML7 keeps patients from needing additional work at the clinic, would you say?
We found that flaps to be really stable. Enhancement rates are really low. Patients get the surgery. It's very seldom we see them back. And that's probably common with most LASIK surgeons anyway.
Now, I know patient satisfaction and turnover is a huge component in LASIK success, but let's zoom in on a key technical factor where femtosecond laser supposedly rules supreme, the stromal bed. What kind of an impact does making a smoother stromal bed have for the patient and for the surgeon, would you say?
Everyone wants to have a smoother flap, make sure we get more predictable results. And I think we've seen great improvements with the keratomes over the years. And I think it's important that everyone compares recent technology on both sides. The femto lasers have gotten some better and the keratomes have also gotten better. When I look back on the keratomes we used 20 years ago, it seems like a pretty scary endeavor that we were doing. And it certainly was a lot more stressful than it is now. And now we're able to really have a surgical experience that's not just good for the patients, but also is easy for the surgeon. And I don't find it stressful at all. I love doing the surgery. I'm talking to my patients in the middle of it all the time, so this is not a real issue for me.
Well, talk is cheap, as they say. So let's see the ML7 in action. I think we've got a video here.
So we start with the speculum in. We have a variety of speculums we use. Once we have good exposure, put the ring on the eye, get the suction on, we hear the peep. I like to give a few extra seconds to make sure that the pressure is dissipated, make sure we have good suction. The pass goes forward and back. It's very, very smooth. And then the suction comes off. I don't use ink marks. A lot of surgeons do, and that works well for them. I find that just looking at the gutter at the end of the case works well enough for me. And it's also an indicator of how much we trust in the surgery. You can see from the video, the flap lifts up really easily. There's no dissection needed. If you keep the anterior surface dry, then there shouldn't be much fluid underneath the flap.
So we've talked about some of the advantages of the ML7 and we've seen it in action. So if you're or your family were getting LASIK, I have to ask, what technology would you be more comfortable with?
The vast majority of our patients get the keratome. I think the most telling part of this is looking at eye doctors. And so I've operated on now closing in on 400 eye doctors.
Yeah.
And
wow,
90+% of them ended up getting the keratome done for their LASIK. And I think that kind of answers the question more than any other technological aspect. And we've had really, really, really good results with that.
Fantastic. Well, it looks like the ML7 is here to stay. And when you've got dozens of patients to turn over in a day, like Dr. Wolfson, the job needs to be accurate and fast. And the ML7 from MedLogix delivers just that. Thanks for watching, and we hope our viewers found this video helpful and enlightening.